Good afternoon, everyone. Thank you for tuning in to the Government of Newfoundland and Labrador's announcement. I'm Tina Coffey with the Department of Education, and I am the moderator for today's event. Joining us today are the Honourable Tom Osborne, Minister of Education, and Tony Stack, CEO and Director of Education for the Newfoundland and Labrador English School District. Please stand by. Our event is ready to begin.
Good afternoon, everybody. Thank you for joining us. I'm joined today by Mr. Tony Stack, the CEO and Director of Education with the Newfoundland and Labrador English School District. Earlier this afternoon, the Chief Medical Officer of Health, Dr. Fitzgerald, provided an update on public health protocol changes for schools to safely open in light of the COVID-19 variant. Based on her advice, today we are announcing that we are targeting Wednesday, March 3rd for the resumption of in-class instruction for schools outside the Avalon region. At this time, schools in the Avalon region will continue with online instruction for the next 2 weeks. The schools that are reopening will see enhanced safety protocols as recommended by the Chief Medical Officer of Health in light of the new challenges presented by the variant. First, students between the grades 4 and 12 will now wear masks in school for the entire day, and students between kindergarten and grade 3 are encouraged to do so if they are able. Secondly, teachers and staff will be required to wear level 1 medical masks in addition to eye protection in the form of face shields. The district will provide all teachers and staff with the necessary masks and face shields. Both districts have these resources on hand and are in the process of shipping them to the schools across the province. Another change involves the physical distancing. In classes where cohorting is not possible in our high school grades, 2-meter physical distancing must now be maintained. While this is achievable within existing schools with smaller populations or larger spaces, this new requirement will typically require high schools with higher enrollment to move to scenario 2 of the Safe Return to School plan. Our current understanding is there are approximately 50 schools that will require this transition, at least initially. Another change involves physical distancing. In classes where cohorting is not possible in our high school grades, 2-meter distancing must now be maintained. While this is achievable within the existing school spaces, in scenario 2, classes may be divided into 2 groups with alternating schedules. The school district is now in the process of connecting with schools where scenario 2 will apply, and those schools will reach out to their students on next steps in the coming days. I expect this to be the case for most high schools in the Metro St. John's area when they eventually reopen. Finally, starting next week, regulated childcare services outside the Avalon region are permitted to return to full capacity. Last week, we provided enhanced protocols to regulated childcare operators similar to what we are announcing for teachers today, with mandatory masks and face shields on the advice of the Chief Medical Officer of Health. We are in the process of providing all regulated childcare services with the initial supply of masks and with face shields based on the number of employees they have working. With this change, we will no longer be reimbursing childcare centers for fees of absent children in these regions. While childcare operators in the Avalon region are currently required to limit attendance to the children of essential workers who must leave their home for work. We have heard the concerns of some essential workers around access to childcare. We have met with union leadership, and we are currently working with the public health to determine if any other changes can happen in the Avalon region. We will continue to pay childcare fees for Avalon region childcare services for as long as they remain in the current status. This will be reevaluated within the next 2 weeks, along with K-12 in the Avalon region. I want to thank Dr. Fitzgerald for her guidance with these enhanced protocols to keep students and staff safe in light of the new realities of COVID-19 variant. I know these are significant changes for students, parents, teachers, and staff, but as the Chief Medical Officer of Health has indicated, the variant is a new virus. Her guidance is meant to keep us safe. With that, I'll hand it over to Tina for media questions.
Thank you, Minister. For the benefit of our speakers, there are 5 reporters registered for today's announcement. The question and answer session will be conducted in one round, where each reporter will have the opportunity to ask 2 questions. Following this, I will ask each reporter if they have any final questions. Our first questions are from Michael Connors, NTV News. Please go ahead.
Hi, with the new mask requirements for grade 4 and up, why that cutoff? Why is it only recommended for K-3 and required for grade 4 upward?
Thank you, Michael. This is, these are the protocols set forth by Public Health and the Chief Medical Officer of Health. So we are following the guidance of Public Health in this regard.
We've heard of teachers effectively working extra hours because they don't get the, I guess, the sort of normal break time in between classes. Is there anything, I guess, being done for teachers to accommodate these increasing workloads and to, I guess, accommodate mental health concerns?
So with respect to the virtual learning model, which the Avalon region is still under for the next 2 weeks, and the other regions for until next Wednesday, the teacher workload for asynchronous, for synchronous activity, that's face-to-face with your class in a virtual session, it's recommended different levels for different grade levels. To reiterate, 60 minutes for kindergarten to grade 3, 90 minutes for 4 to 6, and then the 7 to 12 grouping follow their regular Power School schedule. And just like in a regular class in a normal fashion, there could be 10 or 15 minutes of instruction, then individual work could be assigned or group work. It's not required that the teacher be sort of the sage on the stage, as it were, for the entire period. It's meant for interactive activities, and there are times when the teacher can, in fact, not be present in a virtual sense and go offline, just as the students are offline for a period, and then return to the whole group or a subset or individual student.
Thank you, Michael. Our next questions are from Richard Duggan, VOCM News. Please go ahead.
Thank you. Minister Osborne, you mentioned that some schools that cannot accommodate the 2-meter physical distancing will have to go to scenario 2 as outlined in the return to school plan. Can you outline what exactly is involved in scenario 2 and how will that look for students?
Okay, Tony.
So, yeah, scenario 2 is essentially 50% of the grade levels or the population affected attending on a given day. So you follow your regular schedule, and then you attend on alternating days. And you know how that breaks down in practicality is Monday, Wednesday, Friday for one group, and then that group then the next week go to school on Tuesday and Thursday. Ordinarily it's a 14-day cycle for most schools, and all of the curriculum interaction will occur within those 14 days. It's just that it's going to be 50% of the time. In the days when students are not attending school face-to-face, part of the pedagogy will be assigning the work, the readings, the preparation in an asynchronous sort of on your own fashion at home among students. Now that's not to say there couldn't be the odd email or check-in, but essentially on alternating days, the students who are now considered, they're more mature students in the high school setting, will have that day to prepare for the next day, to catch up on the assignments. The pedagogy has to be adjusted slightly. It's not ideal, but it's basically 50% of your time attending school as you normally would.
Okay, and I'm curious too about students who are immunocompromised, especially given this new variant and how much more easily transmissible it is. I imagine that they would be a lot more on edge. What is being done to accommodate students who are immunocompromised and may not feel comfortable going back to school yet?
So I can answer that as well. All of the students who were identified in immunocompromised situations have been attending virtual school since the start. We have something called Connect Ed, in which those students who have identified those requirements and that they've been medically documented, they are in fact have been attending that school, a virtual school as it were, since the beginning of the year.
Thank you.
Thank you, Richard. Our next questions are from Lucas Wall, CBC News. Please go ahead.
Good afternoon. In the provincial briefing this afternoon, Dr. Fitzgerald ran down some of the guidelines that you outlined for students and teachers and mentioned that students on the Avalon would remain online. But given the attention that the provincial briefings tend to attract, why not have Dr. Fitzgerald clearly state that the schools outside of the Avalon would open and then leave the specifics and follow-ups to you?
Can you read? I'm not understanding the question.
My question is just, does this decision to reopen the schools off of the Avalon rest with Dr. Fitzgerald and Public Health, or is that with the department and the district? And if so, why not allow Dr. Fitzgerald to make that announcement during the provincial briefing, given how many people are now used to watching those briefings and are in the routine of doing so?
We had met with Public Health and the Chief Medical Officer of Health yesterday. I know that staff at the department and the school district have been in constant contact with Public Health. So the guidance from the Chief Medical Officer of Health is that schools outside of the Avalon region could open. She left the logistics to the school districts, both the English and French school district, as well as the department to determine when this could transition. Dr. Fitzgerald is not responsible for the operation of schools or school operations, and therefore she left it to those who are responsible to determine what the start date was. Both the English school district and the French school district have determined that a 2-day turnaround to move from scenario 3 to scenario 2 in some cases, or scenario 1 in others, was a reasonable amount of time.
Okay, and with masks required now for students grade 4 and up, who will be responsible for enforcing those regulations? Will that rest with teachers, and what would be expected of them in ensuring that students wear their masks and maintain physical distance?
So obviously with the arising of the new variant, I think everybody's aware that we're into a heightened sense of awareness, and adherence to the mask regulations are absolutely critical. We expect most people will understand this and will comply. In fact, right now, the students have been really, really good about this and have been wearing their masks as required. Now, over time, some relaxation may have crept in, but we're into a new era now. I think people understand that. But it is we expect all students in that category, unless there's a documented case on file where they are exempt from mask wearing, we will proceed with the assumption that everyone will wear the mask. And if we encounter issues with that, just like normal interaction with the parents and the student involved, we will move to rectify if there's an issue.
Thank you, Lucas. Our next questions are from Nicholas Mercer, the Telegram. Please go ahead.
Yes, hi. The question I had was, if there had been any talk with regards to the restart of extracurricular activities for schools that are outside the Avalon?
No. Short answer. Given the seriousness of this, there's no plan to resume extracurricular activities at this time based on the current situation.
Okay. I guess the follow-up I had would be to, are there any other mechanisms for different class sizes outside of scenario 2? Whether that be, I guess, dropping them or some other avenue for changing that?
I didn't hear all of it. You trailed off there. You're asking, are we going to change class sizes?
Yes.
So the de facto scenario 2 model essentially halves the class. Now, not perfectly half, but it does split the grouping under scenario 2. So you are changing the class size, so to speak. Those groups that have cohorted and are cohorting, they will continue to do so. There's no change anticipated there.
Okay, thank you.
Thank you, Nicholas. Our next questions are from Greg Mercer with Globe and Mail. Please go ahead.
Good afternoon. Thanks for taking my question. Just to follow up on Nicholas's question about extracurricular activities, I'm wondering if you see a scenario at any point for the duration of this pandemic that we could see tournaments back in schools in Newfoundland.
I think that would depend on what Dr. Fitzgerald and her team puts in place with respect to alert levels. And under the existing alert levels, there will be no resumption of extracurricular at this time. And that'll be in place for the foreseeable future. And I would add that we would have to have a very extensive discussion and analysis before we would entertain returning to extracurricular activities.
Has this outbreak caused you to take a look back at the decision in November to ease restrictions on those tournaments? Would you approach those kind of events differently now, knowing how quickly this thing can spread?
I'll provide some comment and then I'll turn it over to Tony. Back in November, we weren't dealing with the variant. Today we are. Dr. Fitzgerald has clearly articulated that the variant is a whole new virus. It spreads more easily and more widely. The circumstances have changed. Tony?
Thank you, Minister, and that's exactly the case. Where back in fact, at that time when school started, we were permitted to operate with extracurricular activities. We waited until the middle of November and then gingerly introduced a small amount of extracurricular activities. That went very well. And that essentially was broadened slightly in the new year based on what was happening with the epidemiology and the levels at the time. It was in concurrence with the alert level. Hindsight is 20/20. As I say, so in order to revisit a decision to have extracurricular return, we'd had to be really assured that we were in a place where that could take place with respect to the alert levels.
Thank you, Greg. For our final round, I will go through the registered media once, where there will be an opportunity for one question each time your name is called. Michael Connors, NTV News, do you have a final question?
So could you just explain this sort of 2-meter requirement? Just again, it's only for classes that can't cohort or students that can't cohort. If you're in a group that cohorts, the 2-meter rule does not apply?
That's essentially what we have from the Chief Medical Officer today, yes.
Thank you, Michael. Next, we have Richard Duggan, VOCM News. Do you have a final question?
Yes, so daycares in level 4 can open to full capacity, as I understand, and the difficulty of physical distancing in daycares has been noted before, as has the increased transmissibility of this variant. How comfortable are you with daycares operating potentially now with full rooms of kids at this time? And why not still implement some type of a capacity limit?
Thank you for the question. Schools are returning to normal in areas outside of the Avalon region, and early learning and childcare are returning to normal outside of the Avalon region in terms of attendance. What is different than before are the protocols have been increased and restrictions have been increased for both K-12 and for early learning and childcare. This is based on advice from public health, and it's based on the fact that we're now dealing with the variant. But there's been very little prevalence outside of the Avalon region, and public health obviously feel that it is safe to do so.
Thank you.
Thank you, Richard. Next, we have Lucas Wall, CBC. Do you have a final question?
I do. For both of you gentlemen, what would you say to parents who might still have some concerns about sending their children back to class or to childcare outside of their home?
I'll provide some comment and I'll turn it over to Mr. Stack. Dr. Janice Fitzgerald, I think we can look at the track record and what she has done in guiding this province through the original strain of COVID. You know, we were the envy of Canada, and in many cases, I would say the envy of the world. Nobody could have predicted the variant and the level of spread as a result of the variant in the greater St. John's or the Mount Pearl area. But I would say that Dr. Fitzgerald and public health and the minister and the premier have worked very hard to, while we can't say today that it's fully under control, they've largely controlled the spread, and we can see that as evidenced by the numbers that are reported on a daily basis. I trust the guidance of public health and our chief medical officer of health. You know, it's been proven, and you know, with the additional protocols that are put in place, I believe that our schools are as safe as they can be, and our early learning and childcare centres are as safe as they can be. Mr. Stack?
Thank you, Minister. Yes, you know, it's important to note that Newfoundland Labrador has had has been the envy of most jurisdictions with respect to education, the least learning loss in many respects worldwide. So we are in a good place, and we got at that good place because of the excellent advice of Chief Medical Officer of Health. I can also attest to the fact that the contact tracers, the folks that work within the regional health authorities, work round the clock. We've interacted with them well into the evening. They are on it as soon as it happens, and when there is a case, contact tracing is followed up in an incredible effort. So if there does happen to be the emergence of any cases, they are pounced on right away and dealt with. So we're in good stead. We are in a virus area, and so it's possible that there could be cases, but they're doing everything they can to mitigate, and I, will reiterate what the Minister said, have complete and faith and confidence in the measures that are being introduced now. It behooves us within the system now to make sure that they're adhered to.
Thank you, Lucas. Next, we have Nicholas Mercer with the Telegram. Do you have a final question?
Yes, I'm just curious if there was any scenario where that 2 week, where the decision on the 2 week period for the Avalon schools would get increased, I guess, inside that, say in 5 days from now we see uptick in cases in Metro. Is there any scenario where that 2 week window gets extended? Or that 2 week, I guess, cutoff gets extended?
That largely depends on the guidance of public health and the Chief Medical Officer of Health. They understand the epidemiology. They will provide us guidance as we move out of the risk of spread within the community, and school is safe to resume. So the additional 2 weeks that are currently in place will be reevaluated as we get closer to the 2-week timeline, and that reevaluation will be done in consultation with Public Health and the Chief Medical Officer of Health.
Thank you.
Thank you, Nicholas. Next, we have Greg Mercer with Globe and Mail. Do you have a final question? Greg Mercer? Okay, we can do another final question if you have any questions. Michael Connors, NTV News.
Yeah, sure. Just one, buses, school buses. How will cohorting and 2 meters distancing be maintained on school buses? And also, I just wanted a clarification also, there's an exception for students with complex needs?
I will add some remarks and again pass it over to Mr. Stack. If we're moving to scenario 2, there will be less children or less students on the buses as a result. So that in and of itself will provide a greater ability within our transportation systems to provide additional distance. Mr. Stack?
Thank you, Minister. Yes, there were no additional measures for buses. The students, I can attest to, are very adherent to the regulations. They know that they have to have the mask. They line up and get on the buses and spend their entire time seated appropriately. The capacity is much reduced, as you know, down to from a 72 passenger bus down to just over 40. But there's been no changes, no additional measures there. But as the Minister alluded to, there will be some reduction in the ridership, given that some of the schools will be adopting scenario 2. And I can't recall your second question. Oh yes, special those students who have complex needs. So the exception in the Avalon area is that we're reaching out to parents today and into early next week to ascertain their comfort level with the pre-planned attendance of their children at school, despite the fact that we are in the scenario 3 model for the vast majority of students. But those with complex needs who cannot avail of the virtual environment, there was in the plan the ability to have those students attend school on a regular basis.
Thank you, Michael. Richard Duggan, VOCM News. Do you have a final question?
Yes, I do. What sort of communication has been had with the NLTA about these developments, and have they brought any concerns to you?
Thank you. I've had discussions with the president of the NLTA, Dean Ingram, earlier today, based on the conversations that we've had with Public Health and the Chief Medical Officer of Health, to give him a heads up as to what was going to be announced and the fact we were having this news conference. Those discussions and that dialogue will continue both at the departmental level and with the school districts as we proceed through the weekend and into the start or the restart of school outside of the Avalon region on Wednesday. It's my understanding from the conversations that I've had with Mr. Ingram this morning that he sees the additional measures as a positive move forward.
Thank you.
Thank you, Richard. Lucas Wall, CBC News. Do you have a final question?
Yes, I do. Could you explain a little bit about the process now for teachers to get back into schools and prepare for the switch out of online back into in-class learning?
So for those students or those teachers off the Avalon in Central, Western, and Labrador, virtual learning will continue into Monday and Tuesday, albeit I would temper that with expectations for robust full schedules will decline somewhat because they are going to prepare now to shift back into the either scenario 1 or scenario 2. Administrators as well will need time to ensure that schedules are promulgated and that sort of thing. So That'll happen over the Monday, Tuesday period, and then Wednesday we're back into either scenario 1, with his full attendance with enhanced health measures, or scenario 2, which essentially is 50-50 attendance. I should also add, and I forgot to add to the question on special needs, it was related to the Avalon, but also in scenario 2, for those schools that are adopting scenario 2, similarly, special needs students or students with complex needs would also be in full attendance, even though the majority of students would be in a 50-50 arrangement.
Thank you.
Thank you, Lucas. Next, we have Nicholas Mercer with the Telegram. Do you have a final question?
No, I don't.
Thank you. Greg Mercer, Globe and Mail. Do you have a final question? Okay, thank you. Thank you, Minister and Tony. That ends our round of questioning. Did you have any final remarks, Minister?
Yes, thank you. I just want to thank all of the stakeholders, both of the school districts, the NLTA, our educators and staff within the schools. I know that while this has been, a time of some uncertainty, I think that everybody has really stepped up. I'm very impressed with our educators and how they've stepped up through the online learning, and some of the innovative ways that they've kept our students interested in learning online. So just wanted to put that out there, and also again, just to remind everybody that it is important to follow the protocols set forth by the Public Health and the Chief Medical Officer of Health. Stay safe, everybody.
Thank you, Minister. Tony Stack, do you have any final remarks?
Yeah, thank you for the opportunity. Look, just kudos to our teaching staff and the administrators. They've performed some incredible feats in this virtual environment, really broken new territory in ways of learning, and we're very proud of them. I'm very proud of them. As well, all of the support people that make schools run during the day, the secretaries, the custodial workers, and the bus drivers, as well as all the programs people and the finance people in the headquarters that back it up. It's a big enterprise. People really want to do what's best for students, and they have to the best of their ability. And I think we should all be very proud as Newfoundland Labradorians of the type of quality individuals that we have in the school system.
Thank you, Tony. Thank you, everyone. Our time has ended. Take care and enjoy the rest of your day. Have a great weekend and stay safe.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.